I'm Tiffany Graham Charkosky, and I'm an author who just wrote the book Living Proof: How Love Defied Genetic Legacy. And it's a memoir about my experience of genetic testing and its emotional and physical aftermath. Lynch syndrome is a genetic disorder that gives people a hereditary predisposition to a number of different cancers. And the way that Lynch syndrome works is that each of our bodies has a series of genes whose jobs are to repair our cells as they divide and split and do all the work to keep us alive. There's a lot of mistakes that are made during that process. And when you have Lynch syndrome, and also the BRCA1 or 2 mutation, they are called mismatch repair genes. And so it means one of those don't work. And when that happens, your body's natural ability to repair itself is broken. And so that means that the bad cells in our bodies continue to grow unchecked and become like the default copies. And so Lynch syndrome is one of a number of hereditary cancer disorders that leads to that type of activity in our cells. It could be twofold. So it might be that maybe you're a young person and younger than average for getting some types of cancers. And if that happens, a lot of times your medical care team might suggest that you get genetic testing to see if you have one of a range of these hereditary predispositions to cancer. And in that case, that might alter the course of your treatment. So it could be somebody is already sick. In my instance, I'm fortunate in that I was able to get tested for Lynch syndrome before ever having cancer. Knock on wood, I'm what you call a previvor. And that means somebody who has a genetic predisposition to cancer but hasn't yet gotten cancer. And so through genetic testing, I was able to undergo annual screens, and I've had two preventative surgeries. And so it allows me to manage my cancer risks differently than people who wouldn't have that information. Ours were completely different. My mother died when she was just a couple weeks shy of her 31st birthday. So she's much younger than I am now. And she got sick in her late 20s. And this was in the early 90s. And I think a lot of younger women who are otherwise healthy, I think might experience something similar, sadly, which is they might be going to the hospital or to the doctor with, different symptoms, basically like these are gynecological problems or these are stress related problems. They didn't think to look for cancer because of her age. By the time she was diagnosed, she was already very, very sick. And there was never a period of time where it seemed like she was really getting better. She was undergoing a lot of treatment, but never seemed healthy again. My journey was different in that I had genetic testing around the same age that my mother was diagnosed, and it was sadly because my uncle, her brother, passed away from cancer when he was 46. So he had colon cancer, similar, the same kind of cancer that my mother had, and a geneticist who worked at the hospital that he was being treated in asked if she could speak with him and talk to him about genetic testing and explain to him that she felt that he was a good candidate for genetic testing and asked him just a couple weeks before he passed away if he would consider having his tumors sequenced. And they found his MSH6 gene. That's the specific gene that we have. Lynch syndrome has a number of different genes, but they were able to discover his specific genetic mutation in the MSH6 gene. So sadly, I've lost an uncle and a mother to the same disease. And for most genetics, there's something called the Amsterdam criteria for people who have familial cancers. They typically want you to have three relatives with the same type of cancer. My mom and my uncle were only two. Their father had pancreatic cancer. And so the geneticist who was working with my uncle's medical team felt that there were a lot of families who were being missed because of this need to have three relatives and so on. So she was doing research to see if they broadened their criteria, if they could perhaps capture individuals who might benefit from increased testing. And so that's actually how my family was diagnosed. I have two parallel thoughts on this. One is that it's really easy for us to get genetic information right now. There's a lot of DNA testing where you can, take a swab and find out, more about your ancestors or more about your health. And I think in a lot of those instances, you might get information back from those types of like mail order kits, but you don't know what to do with that information. You've sort of been given information about your DNA, and then you have to figure out, how do I put together a medical journey in support of myself. And I think the other side of it is you might feel like your family has a genetic, you might feel like you've seen multiple people get similar illnesses or illnesses in the same family, and say, you could advocate for yourself. You could, go to your medical practitioner and say, I just want to flag these family histories. Am I a candidate for testing? And I think what people need to understand with genetic testing is that it isn't like this, one size fits all treatment. Like there's different genetic counselors. Their job is to basically understand your family history and help direct you in the right ways to pursue your testing and, know what to test for. Something I've learned through my process is genetic testing isn't usually recommended for people if there isn't something medical that can be done to support you. Like, it's not helpful information if you can't somehow make your life better. Even in my instance, I had my testing about 13 years ago. And I can talk pretty openly about it now. At the time I was going through it, it felt like a death sentence. It felt like I know exactly what the worst case scenario for this is and how am I supposed to live with this information. So I think there's sort of the practical side of it, which is, what tests do you need to do if you test positive? What are the recommendations for medical screening and so on? But you can look at those in a really black and white way, but they have very personal implications for people. So in my case, I was really imagining what it would be like to go through what I saw my mother go through what I saw my uncle go through. At the time, I had a toddler at home, and I was pregnant with my second child. And I was really paralyzed and overwhelmed with fear and with grief for a future that I had imagined being different than, what I was seeing. And so I think a lot of people think that a genetic counselor is also a counselor or a therapist. And something I would like more people to understand is that you might also need therapeutic counseling or psychological support, going through this. And I was really lucky in that my counselor, genetic counselor, ended up becoming a psychologist because he felt that he was ill equipped to deal with the emotional side of genetic testing. He's providing this medical information. And what he was discovering is that there were a lot of people who were having these really powerful emotional responses. And he ended up building a practice that was really focused around kind of helping people navigate that. I've been really lucky in that I've talked to a lot of people who've gone through genetic testing and a lot of providers over the last couple of months as I've been gearing up for my book to come out. And what I learned was my experience was much more compassionate than many others. My counselor did have these, aspirations to find a more human and therapeutic side to this, but there are a lot of other folks who are just sort of like, here's your medical information, here's the surgery you need, you'll need a hysterectomy, you'll need a this. And it's a lot of information to take in. And I think there's sort of balancing like the medical side of this, which is like saving your life. And then there's the emotional side, which is, having a life that's worth saving. And so figuring out sort of how to navigate both of those. So I would really advocate for people undergoing testing to be really kind to themselves and try to find a support network, whatever that looks like for them, to sort of help them navigate the ebbs and flows that they will have. And then the other thing I would say was that I had my testing, like I said, 13 years ago. I still have screens every year. I still have, I had one set of surgery sort of very quickly after my diagnosis. I had another set of surgery about 10 years later. And so I think it's something that, it kind of lives with you, and you have to continue advocating for yourself and sort of keeping tabs on, these different milestones along the way. And it depends on whether you're male or female. So, Lynch syndrome tends to impact the colon for most patients. And then if you're a woman, it's a much higher risk of uterine cancer and then ovarian cancer as well. And then there's also several other cancers: skin cancer, kidney, pancreatic, stomach, etc. But what my treatment looks like is I get a colonoscopy every year, and I get endoscopy every 3 years. If I started having like polyps through an endoscopy, I would have an endoscopy more frequently. The recommendation for women is to have a prophylactic hysterectomy when childbearing is complete. For a lot of women, you might say, how am I supposed to know when that is? What does this mean if I already have children? What does this mean if I want children in the future? So there's a lot to navigate when it comes to having children. I was in the position of having already had a child and pregnant with my second, and my geneticist said if I wanted to have more children, I could go through in vitro fertilization, which means they would test embryos and only implant embryos that had tested negative for this genetic mutation. I actually just opted not to have any more children after that. And, this is also something different for every single person. When I had a hysterectomy, I also had my cervix and my fallopian tubes removed. I was 30 when that happened. And so my medical team thought that it was best for me to keep my ovaries until I was 40. And so I had my ovaries removed a little bit after my 40th birthday. And then in addition to those more intensive screens that I've talked through, I get dermatology checks. I, give a urine test. I, get the annual blood work that other folks get. So I'm pretty well monitored. As I get closer to my late 40s and into my 50s, at some point I will have to have some type of pancreatic screen. And in all honesty, I haven't even fully wrapped my head around what that means. I'm sort of like living, a little chunks of time at a time, because if you worry about it all at once, I think it can feel so overwhelming that it can be hard to kind of know where to start. So I'll deal with that in a couple of years. Yeah, I'm actually wrapping up. I'm in the final stage of a clinical trial. It's a phase 2B trial, which means that it has gone through some initial testing. It's funded by the National Institute of Health. And what it is looking to do is checking to see if individuals who have Lynch syndrome could have better outcomes than the standard screening that they're doing if they did a mix of three substances found in cancers. They give like a series of three shots, and then they basically boost those with an immuno boosting shot as well. So it's a four doses of this medication spread out over the course of a year. And basically, you have to qualify for it by having Lynch syndrome. And so I'm not going to lie and say there wasn't a tiny part of me that hoped that maybe I didn't qualify. Maybe they'd been wrong all this time and I didn't really have it. But I qualified for it. And they do a series like every single time I get the test, I have to do a round of blood work like 4 days beforehand to make sure that I'm healthy enough to receive the injections. And then at the end of everything, they started by doing a like biopsy of my colon. So in my normal colonoscopy, take a small tissue sample, and then at the 1 year mark, at my next colonoscopy, which is coming up very soon, they will take another sample of the colon as well. And then I think they're waiting to see how do we fare. I'm in an active trial, which means there's people who are at different phases, and then they are testing to see if this will move into phase 3 clinical trial, which means it will go out to a much larger group of people. So my cohort is 150 people right now. 50% of us getting the medicine, 50% of us getting the placebo, and then we don't know which group we're in officially until the trial is over. It's really hard for me to tell. I'm feeling hopeful right now. I feel like knowing that there are such smart people out there, actively working on how to keep cancer cells from growing is really amazing. And for someone like me, Lynch syndrome felt like the worst luck ever. Like, how could this be? Like, and then to think that actually, like, having Lynch syndrome gives me the opportunity to potentially be vaccinated against cancer as opposed to sort of just in the, general population risk. And when I was reading about whether to participate in the trial or not, one of the things I was reading was that, Lynch behaves fairly predictably. So unlike, spontaneous cancers, the medical community can actually learn from people who have these genetic mutations because they know what to look for and they know sort of how to, I don't want to say how to treat it, but they kind of are learning how our DNA works. And so it's really exciting to me. And it's exciting for me to think that maybe people having like the kind of horrific deaths that my mother had like could be something of the past. If we could get to a point where we can vaccinate against this, maybe like you vaccinate against HPV or something and the cancers that causes, like, that's amazing and I'm so grateful for it. But I'm also an English major and not a scientist, so I don't know what the research says. I think my advice is to feel your feelings and like let yourself be human with it. And if you're not already actively sick, there's one thing, if you're already being treated for cancer and you need to make some decisions, to save your own life, like, I feel like that is on a completely different track than what I'm on. But was so scared. Everything I did for, the first couple of months was just decisions based out of fear, anything I can do to not have this happen to me. So I had my son in July and I had a hysterectomy the following October. So I only had like a 3-month period of time in between giving birth and having the hysterectomy. And I learned about Lynch syndrome at the very beginning of my pregnancy. So I feel like I had like a very hormonally and emotionally traumatizing period of time for that all to happen. And I think looking back, I wish I could have given myself just a little bit more grace and time to feel things and not feel so terrified and make, so many decisions so quickly. I don't know that I would have changed my decisions, but everything felt so immediate and so like I had to know everything right now. And with the benefit of my medical care, I can kind of look back and be a little bit kinder to myself. So I think there's that side of things. And then one thing that my geneticist said to me when she gave me, the diagnosis that I had tested positive was she said, the thing I want you to know is that you're exactly the same. Nothing about you is different. You're the same person you have always been. That was really powerful information to hear because I think for a lot of people, when something goes wrong with our bodies or our minds, we feel like we did something personally wrong. I think that there's a tendency to like feel like a sense of shame or regret or like what could I have done to help this? And I think just remembering that like our genes, we were born with them and there's nothing that we can do. There's nothing wrong with like inherently wrong with us. They're not like a mark of your character or your spirit. And I think that when you're kind of in the midst of battling something, like it's hard to sort of separate like what you would say to a friend or a loved one and like say those things to yourself. So I think I was really, really hard on myself, and that didn't make any of it easier. so so I think I would say get a good support network, be with people who you love, and don't feel shame for something that you didn't do. So I wrote Living Proof How Love Defied Genetic Legacy mostly because when I was going through the genetic testing process, I felt like I didn't have anything to read to make me feel less alone. I felt really like I was kind of in an echo chamber, and I felt like I was slowly like losing my mind in the midst of everything going on around me. And so I really wrote that book because I felt like I needed to. I wrote the book I wish I could have read at that time, which was from somebody a little bit further down the road who had like been through it. And in spite of all of this, like I actually really love the life I have. I have a beautiful family. I have work that I love. I have a creative practice that lets me writing this book. So I feel like I wrote Living Proof, with all of that in mind. And it starts with my dad got a phone call from my aunt saying that my uncle had tested positive for a genetic mutation I'd never heard of. I just thought my mother died, and that was like the defining thing of my life to that point. And I felt like I had survived that. Like it was over, it was something I had gotten past in my brain. And then so the book sort of is structured such that, I learned this information, and it's set up in three parts. The first one looks at like the process of deciding to get genetic testing and what that testing process looked like. And in the first part, I go forward and backwards in time, alternating between like the present day in which I'm sort of figuring out if I'm testing, and then going back to my past when my mom got sick and sort of what that meant for me. I think I needed to be able to show the readers why I was so scared. It couldn't just be like, oh, I might get something. Like I felt like I needed to really show what I was fighting against and why I made the series of decisions that I made. And then the rest of the book is really what happens after testing positive. So, what does that mean? What does my relationship with my family look like? What does my, health journey look like? What am I doing to take care of myself, separate from, medical advice and so on? So it really unfolds over the course of, the real timeline being from getting genetic testing to the end of the book is 12 years. And so it really kind of looks at, different surgeries and the way that process like really is a journey. It also showed me a lot about reconnecting with my mom. I lost her when I was so young, and going through this as an adult, I think it really gave me like a window into like what she was like. And so I hope that it's a story that isn't just, about this like sad medical diagnosis that you get, but is instead really about how you can feel connected to the people who came before you, the people who come after you, and sort of in spite of all of it, like still feel like you can live a really meaningful life, even if you're not living it in the genes that you wish you were born with.